Perfect. Let's go ahead and get started just in the interest of time. Hi, everyone. Good afternoon if you're on the East Coast. Good morning if you're not. I'm Katie Schubert. I'm President and CEO of the Society for Women's Health Research, and we are really excited to have you there, and we really appreciate you all taking the time for this conversation. It's really about supporting women's health, but specifically transitioning into Medicare. So I worked on the Hill for a number of years, and obviously casework and helping constituents navigate the Medicare process was a large part of the work that happened in our congressional offices. And so I could not be more excited to actually have our folks walk through what this guide is and what we hope for it. So I'm joined by Lindsay Miltenberger, SWHR's Chief Advocacy Officer, and Elena Efron, who is Healthy Women's Director of Development. And for those of you who may not be as familiar with our organizations, SWHR is a national nonprofit that is dedicated to advancing women's health through science, policy, and education while promoting research on sex differences. And Healthy Women has been around, almost 40 years, 35 years, is a trusted national nonprofit focused on empowering women to make informed health decisions and to advocate for themselves in every stage of life. So together, we decided we really wanted to make sure that we were working collaboratively to create this resource guide. And today we're going to talk about some of the issues surrounding women and Medicare. There is not sort of a separate information that you get, whether you're a man or a woman, when you turn 65 and you're navigating the process for enrollment and what access to care looks like, and your annual visit and all of that. And so we're very hopeful that this guide can serve that purpose and hopefully will help you all as we think through that. So we have a couple of areas that we've focused on today. We're focusing on bone health. And so in case you did not know, women are subject to bone health disparities. And what that means is about 80% of the estimated 10 million Americans who are over the age of 50 have osteoporosis. And 1 in 2 women will have an osteoporosis related fracture in their lifetime. I know from a personal standpoint, both of my grandmothers had osteoporosis. It's something we're watching really closely in our family. And both of them, when they were in assisted living, broke their hips and unfortunately did not make it out of either surgery or elected not to have surgery and then passed away. And so we feel like this is a really important family issue, community issue as well, and something that we can address. So osteoporosis is also costly. It's responsible for 2 million broken bones and $19 billion in related costs, with implications for rehabilitation and, of course, long-term care. And we've found that women entering Medicare may not know as much or not be equipped with the information and tools that are necessary to help them navigate that process. So before I pass it over to Lindsay Miltenberger, I want to thank our program sponsors, Amgen and UCB, who make this work possible. And I will note that SWHR and Healthy Women maintain complete editorial control and independence over all program contents and work products. And so with that, Lindsay, I'm going to turn it over to you.
Thank you so much, Katie. Thank you all for being here today. As we get started, just want to review a few housekeeping items. First is that we do, as you may have heard if you were on right at the outset, we're recording this first portion of today's session as we review the contents of the guide itself, but we will stop the recording once we move into the discussion part of the event, really just to allow this to be an open forum amongst all of us. Because this is not a traditional webinar format and we're doing this kind of as a meeting format, we do encourage you to mute yourself when you're not speaking, but please feel free to use the chat for any questions throughout today's event, or you can hold your questions again until that second half of our meeting so we can all answer questions and engage in conversation directly. And then we would like to reiterate that this is a closed meeting that has been designed specifically for congressional district directors, caseworkers, and those working in constituent services. If you're not in one of these positions or serving as the designated representative of someone who is, please know that while you are still welcome to stay for this first portion of the conversation, we are tailoring it for that audience specifically. So there may actually be future resources or events that might be more helpful to you to come at a later date. We'd also like to note that today's conversation is not intended for members of the press. So if you are associated with a news outlet, we would kindly ask that you log off and reach out to SWHR separately for more information about the guide. Next slide, please. So to start us off, and Katie was emphasizing some of these statistics earlier, but before we review the components of the guide itself, I wanted to share a bit about our why. Why did SWHR and Healthy Women want to create this guide? And as Katie mentioned, we are using bone health as our example today. So Katie reviewed these statistics, but let's underscore, emphasize them. About 10 million Americans over the age of 50 have osteoporosis, and 80% of them are women. And up to 1 in 2 women over 50 will break a bone due to osteoporosis in her lifetime. Katie mentioned the cost. It's financially costly, yes, but osteoporosis can also take a severe physical toll. She talked about her personal story, but among Medicare beneficiaries, nearly 1 in 5 will die within 12 months of an osteoporotic fracture, and more than 60% of those individuals are women. So together, these statistics highlight not just a public health concern, but an urgent need to ensure that women have access to information about preventive screenings and other care that they can utilize to take charge of their bone health, especially after menopause and as they approach and become eligible for Medicare. Next slide, please. Unfortunately, despite the impact that osteoporotic fractures can have on women, there are still major coverage gaps that exist. So if we look at DEXA scans or bone density scans as one example, these scans are really considered the gold standard in understanding bone density and osteoporosis risk. Women become eligible for DEXA scans once they turn 65. So if we think about that, 100% of women on Medicare are eligible for DEXA scans. They actually may even be eligible earlier if they're deemed to be at increased risk by a healthcare provider. But despite all Medicare beneficiaries who are women being eligible for DEXAs at 65, the utilization rates for these scans are actually pretty low. There was a 2023 study in the Journal of the Post-Acute and Long-Term Care Medical Association that found that among Medicare beneficiaries who were women, before a fracture, the DEXA utilization ranged from 8.5% to 13.7%. So that's really, really low. Beneficiaries are also covered for an annual wellness visit, but only about 40% of beneficiaries actually take advantage of it. This is a huge missed opportunity for us. So knowing what we do about the impact of osteoporotic fractures on women and that there are tools that exist to help women better understand their risk, we saw an opportunity to help. Medicare is overwhelming on its own, so it's no surprise that many people are not aware of what items and services Medicare covers related to bone health, and that the result is a gap in early detection and management of osteoporosis and other bone conditions. Women deserve trusted, reliable, and easy to understand resources to help them navigate the Medicare transition. And we know from research and focus group feedback that current information landscape can feel fragmented and overwhelming. There's a real need for a guide that breaks down the essentials in plain language and helps women make informed choices about their care. Our new guide aims to address these issues, helping women understand their options, advocate for the care they deserve, and take full advantage of the benefits that are available to them through Medicare. Next slide. So it's for these reasons that SWHR and Healthy Women partnered to develop Savvy and 65, a women's guide to understanding Medicare. The idea for it originated with a salon dinner where 20 organizations gathered to discuss women in Medicare, including areas of educational need, gaps, and priority areas. It was through this conversation that the need for a guide like this became clear. From there, we formed a working group, which was composed of experts in women's health, aging, and health policy. We got started on creating the guide, which included a focus group and expert review. And then the guide officially launched in October. The initial guide included 2 chapters on bone health, as we're talking about today, but also a chapter on heart health, along with a more overarching navigating Medicare section. And we have plans to add additional chapters in the coming months. We're also going to be translating chapters into different languages. So we encourage you to navigate to medicareforwomen.org to download the guide, or you can scan this QR code that's displayed on the slide here. And in terms of what's included in the guide, I'm going to pass it over to my colleague Elena from Healthy Women to give you a preview of what's included.
Thank you so much, Lindsay, and thank you so much for having us. And actually, I could pop this link into the chat as well, so if it's helpful to follow along as we navigate through. So what's in the guide? So as Lindsay mentioned, this guide is really intended to be practical and user-friendly, and an accessible resources when preparing to navigate for Medicare. So on this opening slide, it's really an orientation of the table of contents. So what's inside, what you'll see, the details of content information, and all of this information was really especially and particularly intentionally curated from the working group members that were contributing to the recommendations, representing, as Lindsay mentioned, various perspectives and topic areas that would relate to chapter contents. So here you'll see, at sections around preparing for Medicare, which is really the guidance for women starting the process as they turn 65, which would include things like how to research available plans, access to healthcare needs, and then really being proactive around choices. And so while this is a guide around preparing for Medicare, the hope and goal is to actually be able to navigate and peruse its contents before you reach the point of enrollment. So when you do get to enrollment, you're really well steeped and informed around the options and choices available to you. So you can make those decisions with real confidence going into the process. You'll also see information around eligibility and plan options, which will include clear explanations around original and traditional Medicare, because a lot of times it feels like information soup, there's so much going on. And so there's parts A and parts B and part C and prescription drug coverage, supplemental plans. So it's just a lot of information to absorb. So we really intend to help break it down in a way that's both easily digestible, readily available, and usable, accessible. You'll see information around enrollment, like helpful charts and outlines around key enrollment periods that are super important, when coverage begins, how patients can access their healthcare needs, including by listing of providers and prescriptions and preferred hospitals. You'll see different things around insurance interactions, things like information around women who might be dually eligible for Medicaid or who have TRICARE coverage, really trying to walk through the different scenarios that would be really applicable to all women, very inclusive and encompassing. You'll see a sample Medicare prep timeline, which is actually a really practical, tangible tool that women can stay on track. It's really interactive, which not always, information is. And so we really wanted to make this an interactive space. You'll see a doctor discussion checklist, kind of that point. So something that women can download and take with them to their doctors and help prompt discussions and questions that might not flood the mind in the moment when there's just such a download of information. So really helping to prepare for those and guide those conversations around coverage and care. And then there's a section around caregiver considerations, because we see that 66% of caregivers are women, and their unpaid care is valued at nearly $188 billion annually. So this guide really helps provide information and tools to support caregivers navigating that transition as well. And then lastly, you'll see information included in the guide that's not only comprehensive, but again, really just easy to understand in written plain language to help women entering Medicare and preparing to enter Medicare really understand how to best prepare for that transition. So next slide, please. So as mentioned, that practical guide and tool. So this is the doctor discussion checklist. And this guide, does include an abundance of accessible information. And this checklist is one of those examples. So we know that women and people preparing to enter Medicare can often feel very overwhelming, and they're just not sure where to start, especially if you have a plethora of your healthcare support team that would, you're not sure what the coverage might be like or how that transition works. And so this checklist is really meant to demystify a lot of that experience and guide patients and caregivers really through that conversation so they can feel equipped and confident and efficacious around, what is achievable for their transition. So when women are getting ready to move into Medicare, it's really important to check with their current doctors or clinics or services to see what will still work for them. And really, again, looking at it from a proactive place so they can get ahead of whatever transitions or changes might be happening. So get in the forefront. So whether it is to know, does, my clinician currently accept Medicare? And if they take the original Medicare plans like Parts A and B, if they accept Medicare Advantage plans, and then which ones? Will I need to switch providers to join an Advantage plan? And so really, again, just to help prepare, like I know, for example, my mom is in Florida. Sometimes it takes her 3 months to get a doctor's appointment. And so if she knows that that transition needs to happen ahead of time, it can really help prepare for some of those appointments and things like that. Also, it's helpful to think through this checklist on things that might be helpful to ask even the frontline staff or the billing office staff to understand how costs might change, preparing or safeguarding some of those expenses as well. And also asking about services in use. So things like lab work or physical therapy or some other routine care, will it cost more under Medicare? Or if some of these services might not be covered, might they require any pre-authorization? Just to help individuals avoid any surprises that could either delay care or impact their care. And then finally, we really recommend spending some time reviewing medications to evaluate whether prescriptions are typically covered under Medicare Part D, and to identify any specific Part D plans or pharmacies that could work best with specific medication needs. So really thinking through and thoughtfully and intentionally thinking through questions ahead of time to help with that transition and to make it much smoother, again, so individuals can enroll and feel prepared with confidence and ease. Okay, next slide, please. So as Lindsay and Katie mentioned, we spotlight in our springboard of the Medicare guidebook is this chapter on bone health. And so one of the most important sections really focuses on the critical bone health needs of women, which is often an overlooked part of aging women. So as mentioned earlier, women at an older age are particularly susceptible to a lot of health issues and issues like osteoporosis, bone fracture, secondary bone fracture, which can take a really serious toll on their health and their independence. And we know that strong bones really safeguard things like healthy posture, they protect our vital organs, our mobility, and fracture prevention. I mean, I never appreciated my pinky toe so much until I broke it. And so it's things that really impact us that we don't think about sometimes until it feels too late. And so bone health is whole health. And women, as they age, become much more susceptible and disproportionately impacted, as Katie and Lindsay mentioned, by bone loss and bone disease, and especially true for women over 65 or postmenopausal because the estrogen in our bodies is a real key factor for bone health. And as that declines, it can really impact our bones. And so this chapter is really meant to be a critical tool and resource to support some of the navigation needed around essential screenings and care. This chapter is really dedicated to explaining to women what's covered, what's not covered under Medicare in respect specifically to bone health. And it also includes some information about proactive ways to take action to protect their own bone health. So in this chapter, you'll see things specifically like explanations of terms, really level setting, making sure everyone's working from those same definitions of osteoporosis, osteopenia, fracture risk, common risk factors and prevention strategies. Included, you'll see practical tips for supporting strong bones through lifestyle and nutrition. Also details on what Medicare does and doesn't cover. So things like Lindsay mentioned around DEXA scans and medications and wellness visits. Again, questions to ask your doctor, and then also tips for preparing for appointments, because we know the clinical visit is such protected time. We want women to feel like they were able to ask everything and cover everything they needed to in that appointment. Also, this chapter, as well as all other chapters, include resources for women to find really credible support organizations and community programs so that, again, they can be really informed in their decision making. Okay, next slide, please. So this is a really interesting section because it's sort of a Q&A. It's really what if. It walks through some of the confusing, common questions that might pop up, especially when navigating and managing both bone health or osteoporosis and really trying to understand coverage, medication, costs, and treatments options. So this section is a guide that really, of the guide really explores, again, those common what if scenarios. So that way, when talking through some of the practical steps that individuals can take at a time and during. So one common concern we frequently hear is, what if I can't afford my osteoporosis medication? So if someone is enrolled in Medicare Part D drug plan and is struggling with the cost of prescriptions, they might qualify for the Extra Help program, which could provide financial support by lowering premiums or deductibles and copays and medications. Or another common scenario or situation is when medication is no longer covered or perhaps stops being covered by Medicare Part D plan. So what happens next? Formularies really can change every year. And so someone's medication, if it's removed or becomes maybe more expensive under their plan, there's still the assurance of options. So, for example, they might want to ask their healthcare provider whether there's an alternative of medication that their plan could cover, or they might request a formulary exemption to really keep that current drug covered, or choose perhaps a different Part D plan during the annual enrollment period. Another question people often ask will be whether Medicare Advantage covers the same services as original Medicare. So by law, Medicare Advantage plans must cover all medically necessary services that original Medicare covers. This would include tests and treatments related to osteoporosis. However, Medicare Advantage plans may use their own criteria to determine what's covered medically necessary and also could require some prior authorization in certain circumstances. So on the positive note, these plans often include additional benefits that original Medicare doesn't. So it's helpful for beneficiaries to really review those details and those nuances of their plan every year, just to make sure that their selection and their plan still is meeting their real-time needs. So overall, this portion of the guide can really help constituencies and constituents in understanding their choices to really help them stay on track with their bone health treatments, and really ensure that everyone gets and is able to access the care that they need. Next slide, please. And I will hand it back now to Lindsay for some key takeaways.
Thank you so much, Elena. And clearly I was losing my breath earlier. Thank you all for hanging in with me. So as Elena was saying, ultimately, we really know that women entering Medicare are really experiencing information overload. And Medicare itself feels daunting. I mean, even putting this guide together, you realize how daunting the process for somebody entering Medicare or assisting somebody entering Medicare can be. And so with this guide, our intent was really to make that transition easier and provide something concrete so women could have something at their fingertips and have information on what items and services Medicare covers to help them take charge of their health during this critical life stage. And the purpose of this conversation is we know that in your jobs, you're helping constituents on a daily basis, answering questions, providing different resources, pointing people with questions on where to go. And we hope that this guide will be a useful tool for you to use in those conversations. I know that from the focus group, so that was another piece, as we had focus groups on these first initial pilot chapters. And we had a woman in the focus group say, I went and got a DEXA after reading this guide because I didn't know I was eligible. And so we hope this tool will be a great resource for people moving forward and the people that you interact with as an educational tool for Medicare coverage. As we mentioned, you can explore the full guide by visiting medicareforwomen.org, and we will be following up with everyone who's present today with the link and other bone health resources and information that you're welcome to use in your lines of work and with the people that you interact with.